Hello, can everyone hear me? So I'm Dr. Sabika Karim, and I'm going to be talking about something really, really special, and it's about how to get fat loss without any side effects. My disclosures are behind me. I've been in practice for 17 years, and I run my own practice just outside of London, and I've been asked to speak on behalf of Emerald today. And I know in our practices, we all treat patients, and all our patients come to us. We treat their faces. But the thing is, how many of those faces come attached to a body, right? So if we're not treating the body, we are definitely missing out. And patients want to not only look good, they want to feel good, but it's not just the face, they want to look healthier. The ASAPS report says that non-invasive fat reduction methods have increased 77% since the pre-pandemic year of 2019, which is actually quite large. And when the patients come, they just want to look attractive. And what does attractive mean to patients? Sorry. So this is my patient, and you can see that she's quite small. She's not overweight. But this is what Emerald has done for her. So not only does she look good, she feels healthier. So these kind of results I can deliver to my patients with no side effects at all. And we know that obesity is a growing problem in the world, and the statistics that are on screen are absolutely shocking. 650 million people worldwide who are obese. There are plenty of solutions for treating fat. However, there is only one solution out of all the technologies that actually treats the body as a whole and actually helps us to retain our fat cells rather than destroy it, and that is non-thermal laser and the Emerald laser. So again, when I'm talking about people who are overweight and obese, you saw that it worked on a really slim patient. This is another patient of mine, and these are his results after 6 sessions of Emerald. So just so you can see the full before and after pictures. These are my patients and their results. So you can see that the technology works for itself. But it sounds too good to be true, right? How can you have fat loss with no side effects? It's all about the photochemistry. It's all about electronic excitation. And with electronic excitation, this can result in the breaking and forming of new bonds, and it actually helps our cellular processes. And initially when I saw the machine, and I thought, well, hang on a minute, nothing's touching the body, nothing's happening. But actually, if we think about it, electrons are the actual source of life form. We harness photons from the sun's energy, and plants turn them into food. So why can't this have an effect on the body? And the way it actually works, the non-thermal energy, it's believed that it affects the cytochrome C oxidase, which is the rate-limiting step for ATP production in mitochondria. So if we take this rate limit out, we're actually able to speed up the rate at which we're making ATP. Non-thermal laser has loads and loads of properties, and today we are only focusing on fat loss. So what is the solution? The solution for fat reduction with absolutely no side effects is non-thermal laser. There's no pain, there's no downtime, and there are absolutely no side effects that we know. It's FDA approved, it's clinically proven, and we're going to go through some of the papers just now. So why is it important that we're not destroying fat cells? I think as we go along, we've forgotten that the fat is actually an organ. It's part of our endocrine system. It has functions. It's not just to make us look fat or skinny. It's not just for insulation and protection of organs. It actually has endocrine functions. And it's really important to protect the fat organ as our fat system. And I think that's been lost over the last few years. And we know that dysfunction of adipocytes can actually lead to diabetes, hypertension, and vascular dysfunction. So we want to maintain healthy adipocytes at all times. So how did this all come about? More than 2 decades ago, there was Dr. Nero who noticed that there was a difference. He was doing plastic surgery, and he was doing liposuction for his patients. And he realized that if he did liposuction and treated the patients with non-thermal laser before the treatment, the fat that he was harvesting was actually emulsified, and you can see the difference between the emulsified fat that you get with with laser treatment, with pre-treatment, and no laser treatment. So that's a good theory. They then progressed the theory, and some in vitro testing was done, and that showed that the fat inside the adipocytes emulsified. And then many papers have been written about this that show that there is a transitory pore that occurs post-laser treatment. After just a few minutes, 4 to 6 minutes, you can see that there's a pore that opens up in the cell membrane, and that lets out the emulsified fatty acids. And again, you can see that even from the scanning EM. So how does the emerald laser work? It works by targeting the adipocytes that are unhealthy, the overgrown ones. It's a non-thermal injury. It speeds up ATP production, so it makes my patients feel full of energy. And incidentally, my staff feel full of energy because they come in early to have the treatment once a week. I can't get them off the machine. And I'll walk into the clinic and they'll already have had their treatments before we've even opened. So not only do you feel full of energy, but you get the treatment emulsifies the fat inside the adipocyte within just a few minutes, and then you get these transitory pores, and they are open for between 24 to 72 hours after the treatment, and then the fatty acids leave the adipocytes, and they're cleared up by the lymphatic system. And the outcome? Well, I'm going to share with you some of the papers, but what it results in is lots of research and development that have shown us that this actually works. And I'm going to share with you the results of 4 separate research sites through the world that show that this actually works. And they're double-blind, placebo-controlled trials. So in the first one, these patients who were 21 patients up to the BMI 30 were treated, and this is abdominal circumference that we were looking at. They had 2 treatments a week for 3 weeks, so a total of 6 treatments. Each treatment's about half an hour, so it's not really that long. No pain, no downtime, no side effects. Half an hour out of your life once a week or twice a week. And what was really important was that we noticed that the placebo group, yes, they might have dropped almost a centimetre, but actually the treatment group lost far more than that, and I think it's almost 5 centimetres. It's just over 4 centimetres in abdominal circumference, and that's a really consistent measurement. And what does that look like? 4 inches of fat loss? That looks like, well, it's on the screen. Pictures are stronger than words, right? Okay, so it works for people who are normal and overweight. Does it work for obese and very obese patients? Another study was done where patients with a BMI of between 30 and 40 were treated. And actually, again, you can see that the fatter you are, or for the obese and very obese patients, they actually had more of a dramatic effect because they probably have more adipocytes that are damaged, that are being treated by the laser. Okay, so it works around the abdomen. Does it work anywhere else in the body? The next study looked at arm circumference, and it showed that yes, emerald laser has a very good positive effect on decreasing the arm circumference as well. So now we know it doesn't only work on the abdomen, it works on the arms as well. So it can work pretty much anywhere in the body. So it works, great, yeah. So no downtime, no pain, no side effects, and it works. Question is it safe? What's happening to all that emulsified fat that's leaving those adipocytes? Well, this next study was done where we looked at serum chemistry for all the patients who'd had treatments, and there was absolutely no difference in the serum chemistry. So all of that lipid didn't show any elevation. So we know that we know how the fat is dispersed, but does it affect other parts of the body? The study that was published in 2012 in Lasers in Surgery and Medicine looked at 689 patients, and it showed that the circumferential reduction that was exhibited wasn't due to laser or fluid, and it didn't mean that you didn't get growth in other body areas. So it means that it's not affecting other body areas. It's not like when we do apoptosis, where some of the fat cells are destroyed, and then fat cells in other areas may compensate for this. Because we're not destroying fat cells, because we are maintaining them and making them healthier again, we don't need to develop adipocytes in other areas. We're just making healthier fat cells and maintaining the whole fat system for our own health and our endocrine system. So, the treatment of excess adiposity should always be retaining the fat cells and making them healthier. Again, because the fat really does have a huge role in our bodies. So, in summary, there are absolutely no side effects. Sorry, I'm just going to go back to this picture. This is a picture of a well-known side effect that we all know, paradoxical hyperplasia. And if we want to treat our patients with no side effects, this is a laser that we can happily employ. No pain, no downtime, no side effects, no changes in blood chemistry, no fat redistribution. Increase in ATP so you make your patients feel amazing. And actually, you can reduce the risk of the effects that can lead to diabetes and vascular disease as well. And because it's a non-thermal laser, we can treat multiple body areas all in the same time, and it's a full 360 program. So it doesn't treat just one tiny small pocket of fat. You think, okay, I've got a little lump here, I'll treat that. It actually treats you 360 degrees. It's a full circumferential treatment. And actually, when my patients have had it, they've seen the results that I've been sharing with you, and there are more to come. But actually, what they're saying to me is that they feel full of energy, and they feel that they have all the other benefits of non-thermal laser, which is, again, anti-inflammatory. So I know that people who have joint pains, this is just anecdotal and not from Emerald Laser, they have, bloating in the gut and the bowel. They will tell me that they feel a difference. I've had my patients with period pains come in, have a treatment, and they feel better. In fact, over December, it was really cold and everyone was miserable in London, and they all had a nasty viral cold. And I had patients coming in to go on the machine just to help them feel better, feel full of energy. And the fact that it treats their fat as well, that's a bonus. But for most of my patients, that's the primary reason they start. But it's the other factors, in addition to the treatment of their fat, that they won't stop. So sharing with you some clinical results. This is not my patient, but these are the results of, I think, 6 treatments, and it's a before and after, and you can see that it's a full 360. I know there's a slight difference in the size of the pictures because the previous ones I've shown you are all standardized sizing, but you can clearly see the projection has definitely gone down, the love handles have gone down, and the back fat has decreased. Again, another happy patient from another clinic. And we're showing you abdomens and midriffs because, as we know, middle age spread, it's what affects most of my patients, male and female. But actually, we can use it in the submentum as well. And there's very little that you can do in the submentum with no pain, no downtime, and best of all, no side effects, right? So, again, this is another one of my patients now. I would have found him really hard to treat with any of my other devices. And actually, to be fair, I have a whole suite of devices, and we use them for different things. I have a HIFN, muscle stimulating device. I also do have a cryolipolysis. But actually, this patient, I would have probably turned away. Only because I didn't think there was that much pinchable subcutaneous fat, and I just wasn't sure what results he was going to get. So I put him on the Emerald, and I will share his results with you. There you go. Do you want to see that again? That is his results 2 weeks after 6 sessions. So the ones I showed you right at the beginning, which were really impressive, that was easy, right? Because there was some subcutaneous adiposity. It was pinchable. We could treat that. Yeah, we'd be really happy. This gentleman, I would have ordinarily turned away. And just to show you, that's the actual measurable difference when you superimpose the pictures and they're the same size. And the last patient I want to share with you, because I've got about 30 seconds left, is another gentleman. And again, he wished to have treatment. And again, this was that sort of stubborn abdomen where you think maybe it's a bit visceral, maybe it's not. It wasn't. There was subcutaneous adiposity there. That's why I treated him. So if you look at the arrows, you can see that the pictures are the same size. But you can see the reduction he's had on his abdomen. And that's, again, 2 weeks after 6 sessions. But it's not just abdomens I've been treating. I often get patients who ask me about cellulite. And actually, it's become one of my staples for cellulite treatment. And I can combine this treatment with any other treatment that I provide, whether I'm providing another type of body treatment in a different modality, whether I'm using radio frequency for cellulite treatment, injectables for cellulite treatment, whatever I'm doing, I can combine emerald laser because I know it's not painful, there's no downtime, and best of all, for my patients, my staff and myself, it's safe. Thank you. Do you have any questions? Yes. The question has been, is this is a green laser? I said yes. The question has been, what about a red laser? So you can get red lasers, which are non-thermal energy, and actually Erchonia, which is the company that makes emerald laser, do have some. So if you'd like to go to the booth, it's C119 behind you. You could talk to them about red laser technology. But I think red is used for slightly different purposes. It's pain management and anti-inflammatory, if I'm not mistaken. Any other questions? Yes. Sorry. So just to go back, emerald laser is not indicated for visceral fat. It's indicated for circumferential reduction and fat treatment. That's what its FDA clearances are. But it is the only laser, the only device that is cleared up to a BMI of 40. Anything else? I'm sorry I had to talk really fast. I just about managed to get it all in. So if there's no other questions, I will leave you to your next talk.